स्टार्ट करें.
Bismillahirrahmanirrahim. I am Dr. Mohib ullah Wazir. I give you the comprehensive concept of the anatomy of the heart. Please look over here, please. This is the anatomical position of the heart in the thorax. So what you see, this is the anterior or sternocostal surface. And this you see, this one, this is the diaphragmatic or inferior surface. And that is the base or posterior surface, this one. The surfaces I will discuss separately. Today I only discuss the structure which you can see easily, and this is important to study the anatomy of the heart. Before that you should know all these structures. Okay, now you look over here, please. You see, this is the right atrium. Look, with the right auricle. This is the right auricle and this is the right atrium. And then look over here, please. This is the right ventricle. The right atrium and the right ventricle are separated from one another by this atrioventricular groove or coronary sulcus, which contains this right coronary artery. Okay, then come over here, please. On the anterior surface or sternocostal surface, you see this groove, anterior interventricular groove. And this anterior interventricular groove, it separates the right ventricle from the left ventricle. And contained in this anterior interventricular groove, this is the anterior descending branch of the left coronary artery or anterior interventricular branch of the left coronary artery. And along with that is present the vein. You can see it, this vein. Okay, and then you look at the inferior or diaphragmatic surface of the heart. Now you will see over here again this posterior interventricular groove, which contains the posterior descending or posterior interventricular artery along with this vein, posterior interventricular vein. And then you can see over here that the two ventricles are separated from the atria again by this sulcus, which is again called as the coronary sulcus, and it contains this big vein. You can see this big vein. Is it clear? This is the coronary sinus, and opening into it from this side is the great cardiac vein, and from the right side it is this small cardiac vein. From over here it is the great cardiac vein which opens into the coronary sinus, and from over here from the right side it is the small cardiac vein that opens into the coronary sinus. And then on the posterior surface, the upper part, this you can see over here, this is the posterior, this is the left atrium. Look, and this is, you can see over here, the four pulmonary veins. Look, to these ones and to these ones. These four pulmonary veins open into this left atrium. And in anatomical position, you look over here, please. The right atrium is to the right and anterior to the left atrium. This is the left atrium, and this you can see, this is the left auricle. Okay, and over here you can see over here is the left coronary artery. Alright, and then you look entering into the right atrium from above. This is the superior vena cava. Look, and from below, look, this is the inferior vena cava. Look, this is the two big veins This is the superior, this is the inferior vena cava, which opens into the right atrium. And then you can see this sulcus. Look, this is called as sulcus terminalis. This groove, which is called as sulcus terminalis. And then you look over here, please. Again, this is the right auricle. This is the right ventricle. And from the right ventricle, you can see ascending upward. This is the coronary artery or the coronary. This you can see, this is the pulmonary artery or pulmonary trunk, which is the artery, but it takes deoxygenated blood from the right ventricle, and then it divides it into the right and left pulmonary arteries. And then you can see over here that from the left ventricle, the big aorta originates from the left ventricle. This is the aorta. This is the aorta. This is the superior vena cava. This is the pulmonary trunk. In this way, there are two arteries. This is the aorta and the pulmonary artery, a pulmonary trunk, and this is the superior vena cava, the pulmonary veins. Between these two, this area between the arteries anteriorly and the vein posteriorly, this is the transverse sinus of pericardium. And over here you can put your finger easily and you can ligate the arteries very easily during coronary bypass surgery. Okay, and then you can see this is the right ventricle, left ventricle, and both this follows over here to the apex of the heart. This is the apex of the heart, which lies in the left fifth intercostal space at the mid-axillary line. This is the apex of the heart. Okay, these points must be clear to you, and you should listen and you should look it many times so that we want to discuss individually, that it will be easy for you to understand. Thank you very much.